So I had actually, I sort of spent a year thinking about getting a consultation at Free Range prior to doing that, because at that time I was looking for a second opinion about my diagnosis, just because I was sort of going back into a place that I felt that I had been feeling prior to starting medication or seeking help at all, which was extreme fatigue, depression, panic attacks, anxiety, sleep paralysis. I had really bad agoraphobia that started stirring up again. Lack of motivation, and then some other sort of physical symptoms as far as like muscle weakness, really bad tremors. It's like a laundry list of stuff. So that was sort of, I was getting scared that I was going back into a place that was really bad for me before. So it was like a long period of time. So this whole journey has been about like 8 years. So I've been with Free Range for a year. So like 7 years of everything else. So I first sought out help from my physician, just because of mainly because of the agoraphobia. I just couldn't do anything, and I had just graduated college, and I needed to get a job, and like I couldn't leave the house because I was terrified. And my mom was like, "Hey, you gotta do something about that." So I saw my physician, and she put me on Zoloft. So that was initially the first couple months were a little bizarre, just the symptoms I was having from that, which was it's kind of hard to explain, but you could sort of feel like you could feel your mood changing. You could feel things happening in your mind, which was kind of spooky. I sort of like I completely changed. I was able to drive. I was able to get a job. I was able to socialize and go to bars and like do all of this stuff. So it sort of gave me the illusion that it was working. But over time, I was just like, sort of like exhausted. I couldn't sleep. I couldn't eat. I was drinking a lot. I was working like 3 or 4 jobs, so I was never home. I was sort of just like living in my car. So I had like distracted myself with all of this stuff. So I wasn't really focusing on what my mind and my body was telling me. So that went on for about 2 years, and I had, like a mental breakdown. I started feeling super suicidal. I lost a ton of weight. I looked like sickly. I just felt like I was suffocating. And I got really, really scared because I was acting aggressive towards people that I cared about. And I think that's it. Once I felt like I was going to emotionally or physically harm someone in my family, that scared me enough to seek help from a psychiatrist. So that took a while. I'd reached out to multiple places, and because of where I live currently, there's not a lot of resources for mental health. There's one place, it's a community mental health center that's like an hour and a half from me. So, so I got a referral to go there. I had like a 30-minute consultation, and he's like, oh, you have this. Diagnosed me with bipolar type 2. And he took me off the Zoloft right away and started me on a new medication, which was Lamictal. And that transition was kind of hard. Over the years, I've just sort of realized that I'm very sensitive to medication in general. It was weird. I think that the whole experience was weird just because of the mindset I was in. I was sort of in, I guess you could sort of call it a trance. I wasn't really focused on my surroundings, but I was also, it was a super crowded place. I had to wait for a really long time before seeing him. So it was a lot of like buildup of anxiety. So the diagnosis itself was a bit of a relief for me because I felt like I had an answer. And it gave me sort of like a sense of hope. So there was a bit of like, it made me feel sort of hopeful, but I also felt like I was having to start over again. So, but later on, it wasn't until later on that I had considered that maybe this diagnosis wasn't accurate. And I was with him for, I want to say 4 or 5 years. And throughout that period of time, I was continuously on Lamictal, but we also tried other things in conjunction with those, because I'd go through periods of time about like probably like 2 or 3 months where I'm feeling really good. And I think that, has to do with, one, me being hopeful that like this time things are going to be better. This is going to be the one that works. So I'd get myself like hyped up. And then, like the 3 or 4 month range hits and you start to go downhill again. And, like there's this sort of feeling of like, do I even like, do I have to start over again? If I have to start over again, do I want to start over again? Can I just deal with, can I deal with this? So there was a lot of that. One, just sort of convincing myself that maybe this was something that I was just going to have to deal with, and I needed to figure out a way to be content with that, whether it be just accepting it or, again, distracting myself with, other things, whether it be a hobby or going out, socializing, but ultimately none of that stuff helped. I mean, it's affected everything in my life. Just because like even anxiety affects your ability to like function. So that on top of, everything else, I was just super irritable and short with my partner. I was so absorbed in my own like just like this constant buzzing in my head, of just things that I have to do or things that I did 5 years ago, or it was so hard for me to focus on anything other than, anxiety really, or depression, or so it really, I felt like I wasn't able to nurture my relationship the way that I wanted to, and the same thing with work. I mean, I was just constantly like mentally and physically exhausted. I mean, the one thing that I give myself credit for is like when I'm at work, and like if someone is watching me working, they're gonna think that like I'm giving 100%. I'm like giving everything I can while I'm at work, even if like my 100% that day is like 50%, if that makes sense.
Yeah.
But when I get home, it's like game over, like dead. I was, I work 6-ish hours a day, which is like nothing. And I would get home and, I would take care of my dog and I'd sit down and that would be it. I'd be out for hours. I could not function without an enormous amount of sleep.
Yeah.
And it wasn't really sleep. It was sort of just like restless sleep. And I was struggling with sleep paralysis as well. So yeah, I felt very consumed by sort of everything that I was struggling with. And it just felt like I was drowning. I am. That's also something that, like working with the free range doctors, that's something that I've had to work on just because it's been detrimental to my health. I mean, I've just always been someone who feels like I need to do everything 100% all the time. It's just sort of been ingrained in me since I was a child.
I relate. Yeah.
So, I mean, it's good in some sense as far as like, like if I know what I have to do, like if this are going to make me feel better in the long run, yeah, I can do them. But also having sort of like that obsessive habit-based personality can be detrimental too. So it's, sort of this process has helped me align myself in a positive way so I can use sort of those qualities that I have to better myself instead of just like, I don't know, having it sort of keep me in the same spot. So there was never really a discussion with the psychiatrist about how long I would be on medication. That wasn't it was sort of like like, here, let's try this. Was it working? Let's increase this. So it was like I didn't get a lot of information about like where this would take me in the future. It was sort of just very like immediate, like we're thinking about what's going on right now. And yeah, there was just like not a lot of information given to me about even the side effects of the medication. So that was, and I think I was a little naive too, just because I don't know, like it was something that was foreign to me. So yeah, I wasn't given a lot of information, and I think a large problem that I was having going to a community mental health center is that there's limited doctors. There's a ton of patients, and the doctor that I happened to be seeing was double booking. So we'd be waiting for like an hour and a half, and someone would be like, what time's your appointment? What doctor you're seeing? And like 3 or 4 people would have the same time. So I'd wait like an hour and a half, sometimes longer, and have a 5-minute appointment. So there's no way you can fit in everything you need to discuss in 5 minutes. So it was sort of like, okay, where are you at right now? Do I need to make any adjustments? And then that was it. So yeah, it wasn't, there was really no discussion of like what is this medication, what it's going to do to my mind and my body, what it like, could it be, instead of seeing positive improvements, am I going to see some other things that, that might be alarming, or is it going to make some things worse? Like, there was no discussion of that other than the fact that he was like, oh, this might make you gain weight. So, I was with him for a few years, and then I decided to seek a second opinion. And that sort of included, I hadn't really decided that I wanted to go down a path that would be, maybe coming off of my medication. It was sort of like up in the air a little bit. It was something that I had thought about, but I didn't think, I sort of didn't think it was an option, just because I had been on medication for so long, and it changed me a lot. So it was a little scary to think, like, if I came off medication, would I be where I was before I even started it? Am I going to be back in that place? Mm-hmm. Am I going to be a totally different person? It was a lot of uncertainty, and it was really scary.
Yeah.
So I found another psychiatrist for a second opinion, and he said, you sort of don't fit into the bipolar 2 category. I'd say you have bipolar type. So he couldn't really give me a diagnosis, but he said, this medication, like, he kept me on the Lamictal, mm-hmm. and he's like, let's add lithium. And I was like, and I had at that time discussed maybe, like, is it possible that what I'm experiencing now is from the medication I'm taking? Because, it's unlikely, we have studies on this, and, you've been on this medication for this long. Why are you experiencing this stuff now? Mm-hmm. So I tried the lithium, and then it's sort of the same pattern with me as far as changing the dose or changing the medication in general. I'll have a period of time where things, like, sort of the initial changes that go on in my body when adding a medication or changing the dose, which is for like a couple weeks. And that could be, sort of feeling like having the flu, being irritable, mood swings. And then I have sort of this high point that lasts a few months. And then sort of things start to decrease. So I sort of knew what was going to happen when seeing this doctor. I was like, I've been through this before.
Yeah.
But let me try it. Like, I'm seeing this new person. He has to have, like, he had a lot of good reviews. So maybe I'm just being super cynical. So I tried it, and then it wasn't really helping. It was, it's sort of hard to list all the symptoms just because there's so many. But one thing that was really concerning was my memory. I was, like, I would call my mom in the morning asking her a question, and then in the afternoon I would call her and ask the same question with no recollection of me calling her in the morning. So that was a bit of a concern. And then, so, and I mean, like, I expressed all that to him, and he was like, oh, well, it's taking, like, he would check my lithium levels every, I think, however many months. And as long as the levels were good, it was, like, to him, fine.
Yeah.
He's like, well, like, there's not too much. You're sort of, like, right at a good point. So I felt like he was very much on, he was very focused on, like, the numbers and the papers, and, like, I felt like he just wasn't seeing me as a patient. And so I had decided to look into more of a holistic approach after he had prescribed me Zoloft again, which I had such a bad reaction to, and expressed that to him. So I felt, in a way, sort of betrayed, and what he just like didn't listen to me. So, but I figured, like, I'll try it. And I had a very bad reaction to it. So I was like, this is, like, this is it. I need to find something else. So I think, like, ultimately that was a really bad time. But I think I really needed that to push me to really seek what I wanted as far as like psychological care.
Yeah.
So yeah, I mean, that was a very important part in my life, because I had been looking at free range sort of around the same time I was looking for sort of the second doctor I had been seeing about a second opinion. And at the time, I don't think they were accepting new clients. So I was like, so to me, it was sort of, I think it wasn't the right time. I think I needed to have, I mean, that experience with the second doctor, I think I needed to have that in order to like really validate that this wasn't the right path for me. So I sort of, I mean, it was sort of a nerve-wracking experience just because what I touched on before is scary to, well, I mean, I didn't even know if this experience would lead me to being off my medication. But I had decided that that if I needed to be on medication, that's fine, as long as it's the right decision. Like, as long as this person is listening to me and like understanding my full history, and they're like 100% certain that this is going to be right for me. So I went into this experience sort of just accepting whatever would happen, just because I had had bad experiences prior, and I was like, oh well, it can't get worse. So my first appointment was great, and I think the most important thing was, well, going back, the website was super super helpful. Whoever, the graphic designer, did a great job, just because it's super welcoming. And I know it seems like sort of something small, but having like a welcoming website that has sort of like oodles of information about the doctors is really helpful. Whereas most websites are super just like medical, and like, so that was super helpful. But the initial appointment, the consultation, I felt validated like right away. That was like, in that moment, I knew that it was the right fit for me. So yeah, feeling validated, feeling like I'm really being listened to. And then the legwork prior to that, like the questionnaire and stuff like that, was super thorough. So I felt like, one, no time was wasted. There was already sort of a game plan, as far as like the workbook that I got. Things had sort of already been laid out. As like, I felt like the initial consultation, they sort of, or Dr. Campbell already knew me a little bit. So that was super helpful. I felt like, that I was like being heard, and it included every part of my life, not just the mental part, but like the physical difficulties that I was having. And I felt like she just sort of got what I was going through.
Yeah.
So it felt like I was talking to my other doctor about it yesterday, and I was like, it just felt sort of like magic, and that sounds super like, icky, like cringy.
Not at all.
It was like that. It was just like the perfect fit. So yeah, and it's been like that, I mean, since it's only been a positive experience. There's been difficulties and stuff as far as like working through things, but that's, you know, like that's just part of life. But yeah, I mean, it sort of very quickly felt like, yes, this is like where I'm supposed to be. So yeah, it just felt like the right fit, and I felt very welcomed and understood, and you know, like I really appreciated feeling like someone was like actually excited about sort of like the journey we were going to be on together. That was super refreshing. So we started with the workbook first, and that went on for a few months prior to even touching the medication. So with that, it's mindfulness practices. And I had some experience with that prior to starting free range. But those, I mean, the practices are super helpful. One, because it's pretty structured. So you have, you know, like a week of however many activities. So it's sort of like, I sort of just aligned with that one because I'm just very routine based. So it sort of came naturally. So yeah, I mean, and there's some that were difficult as far as like, they can be very intense. And there's other ones that sort of just fit into my schedule now. And they become, it's sort of like muscle memory. Like it's not so much of an effort anymore, just because it's a habit now. But the most helpful has been just the 3-minute breathing exercises, which sounds like, I mean, that's like the easiest one. But really, I go from like 0 to 100 really quick. So really taking a couple minutes to just like quiet myself has been helpful. And if you would have told me that a year ago, I would have been like, what? But you have to trust the process. That's what I tell myself that all the time. Just trust the process. What have you got to lose? And it works. So yeah, that's been, the 3-minute breathing exercise I do every day. So it's called the 3-minute breathing exercise. It's like a sitting breathing exercise, but the book is the Mindful Way workbook. So it has mindfulness practices like mindful eating, mindful walking, sort of just like immersing yourself in your surroundings and being like hyper focused on certain things to, I mean, like ground you and refocus you. So yeah, I mean, it's like it's been super helpful for me. Just taking just taking a second, especially when you're someone struggling with anxiety and you feel like you can't, like you don't have a second to take. So just giving yourself time. And the good thing about the book is that it's scheduled. So like you have to schedule these activities in your day. So, like you're holding yourself accountable. So, like I have 3 minutes to spare, or I have, like an hour to spare for a body scan. And you do have that time. It doesn't feel like you have that time, but you do have that time. And the good thing about mindful practices is that, like you can do that with every activity. Like if I'm at work, I can be mindful while I'm working, or, if I'm laying down and watching TV, I can be mindful while I'm watching TV or walking my dog. So there's no excuse, which for me was like a big thing because I'd make excuses. And I was super huge on self-sabotaging. So this book has been super helpful. And then, of course, going over all of that work and the appointments and making sure I'm doing things properly. One, I think it gives me time to not think. So that it's like I need a break before I can think clearly, and it gives me that space. So it's sort of like reins me in. I guess. I mean, it's kind of hard to explain. It's like it seems very simple when you're practicing it, but then describing it to another person is kind of tricky. But yeah, I think it gives me space from myself, but also brings me closer to my surroundings. So it like gets me out of like my headspace a little bit, and like allows me to really focus on like what I'm feeling in my body, or like what's going on around me. Just focuses me. I'm on quite a few supplements that have also been super helpful. So B12 for sure. So I was, so Dr. Campbell did a ton of lab work, and I had very, very low B12. So I was doing injections for a certain period of time, and then switched to the tablets. That was super helpful with fatigue. That's something that I still struggle with now, but I don't have to like take naps every day, like 4-hour naps every day. I don't have to do that anymore. So that was super helpful. And then, I mean, all of them have been super helpful because I was having a lot of like women's health issues, and that's helped with that. I still am having digestive issues, but it's been helpful with that as well. But I think the biggest thing that I've noticed is my change in fatigue, which is, I mean, like a huge deal. Feeling tired affects everything. Like it intensifies your depression, your anxiety, your focus. So yeah. And then I'm trying to think. Yeah, I guess that's it. So something that has been super helpful that I've gotten from the book is specifying different activities as like leisure activities or mastery activities. So that's been super helpful. So like what am I going to spend my time doing, like my free time? am I going to spend my free time, you know, sort of just laying down, doing the, you know, like sort of just moping around, or am I going to spend my time doing something like, I'm a crafts person, so like, am I going to spend my time in the shop doing these things? So really using my time effectively in a way in which is going to not only make me feel good, but like give me a sense of accomplishment and achievement. That's been super important. Because it's very easy to sort of just like lay down and watch a movie, which is fine too. Sometimes you need that. But for me, it's so easy to fall into a place where I don't feel like doing anything. So creating time and space for activities that are going to give me like a feeling of purpose, and have like an end goal to them. That's super important. And then having something to like look back on, like, hey, I did this, like, see, I can do this. That's super helpful for me. Like, I need physical proof that, you know, like what I'm doing is working. So it's been a little bit of a roller coaster, but it's gotten better. Like I said before, I am pretty sensitive to medication and the changes. So starting out, I did experience so like mood swings, irritation, depression, physical symptoms as well, as far as like nausea, sort of like ocular headaches, like muscle fatigue and pain, and then like appetite changes. But specifically, it was a little bit difficult as far as noticing your mood go into a place that is worse than you were before. And you need to remember that it's going to, like, you have to remind yourself that this is temporary and it's going to get better. So that was a little bit tricky. But what was helpful was keeping a journal, so that I can track the progress, but also, I mean, there was a pattern to it. So, you know, like it would be this amount of time until I started noticing changes. And then I would experience, you know, sort of like depressed mood, panic attacks, stuff like that for this amount of time. But, you know, I know once I hit like the 2-week mark or the 3-week mark, things are going to get better. So keeping track of that is super important. And then over, you know, like what was super helpful is that we did this over a prolonged period of time. Whereas my prior experience with other doctors was sort of abrupt changes. So, and also like having to be patient, like patience is super important. So, but I mean, like, and honestly, it's been less, just under a year. And, you know, I have 2 more weeks. And you know, like I'm on my last 25 milligrams. So it hasn't, you know, like what is 1 year of this compared to 7 years of, you know, the other stuff. Well, yeah, I mean, like, I don't want to say it felt easy, but I think ultimately, like, that first appointment, I decided that like I was going to do whatever it took. So yes, making the time at first seems like an enormous amount of time, and how can I fit this in? But over time, you just, I mean, like, it just becomes part of your life. So definitely, like, again, trusting the process, sticking to it, and yeah, I mean, like, having outside support is super helpful too. You know, like having a really good support system that one understands your experience, and your history, your mental and physical history, and then is sort of observing your changes and stuff like that. That's super helpful as well. Or someone who can be like an accountability buddy. Sometimes people need that. Someone to sort of make that phone call. Hey, you know, like, what are you doing right now? Are you sitting on the couch right now? Like, mom. So yeah, I mean, it's I think a lot of the legwork was done before I even scheduled the appointment. Like, once I decided like this was the path that I wanted to go down, I was ready. So yeah, and I mean, it wasn't easy, but it felt easier than continuing on the other path of just one, being scared that I was going into like this downward spiral and I was going to be, you know, like, sort of stuck relying on this, you know, little pill or pills for the rest of my life. It made me feel super weak. And yeah, so it was a lot easier than just feeling uncertain and not knowing, you know, what the next year or 6 months or, you know, like however many years would be like. And then, you know, like noticing positive changes that, you know, that seeing the progress, like the progress held weight. Like, it wasn't, oh, I'm doing good for, you know, like a couple weeks and now I feel like poop. It was, you know, like I'm continuing to make progress and continuing to feel better. So yeah, again, like, it was giving me proof that, you know, like, the process is working, and like my effort into, you know, the effort I'm putting into this is working. Yeah, so it's actually, so it doesn't feel like, when I'm talking about it, I notice more that it's a drastic change. But like day to day, I just feel like a normal person who's able to, like, you know, enjoy things. And I mean, because of COVID right now, it's sort of like a weird time to be, you know, sort of like on this journey.
Also kind of the perfect time, I think.
Yeah, I mean, yes, and you know, like, it's also, I sort of, one, because I one of my issues before was like really isolating myself. So there are parts of me that feel like, and not like I want to put it to the test, but I was like, well, you know, like, you know, this period of time right now is very comfortable for like the introverted me. So, but yeah, I mean, like, day to day, it seems very subtle, but when I'm talking about my experience with people, I'm like, oh yeah, I used to feel like that only a year ago, and now I feel like me. which is sort of like a really nice thing to focus on, because I was, like prior to seeking out free range, I was very worried about the type of person I would be off medication. If I would, like would I go back to being sort of this like neurotic, like obsessive, like depressed, sort of just scared person. So it's nice, like I have to remind myself that I've made a lot of improvements. But it's sort of nice to just feel like at ease and just sort of average.
You ever think you'd be so happy to like call yourself normal? I mean, that's a normal is really a relevant concept, but I know what you mean, right? Like
there's nothing like spectacular going on in my life. I'm just, like enjoying going for walks and, having conversations with my partner or my dog, or like sitting outside on my deck and sunning, and enjoying work fully, like fully being able to immerse myself in work. Just like, like simple things that were so difficult before. So sleep is a lot better, but that's also something that changed a lot through the process of decreasing my medication. I experienced a lot of sleep paralysis with that, and difficulty, like some insomnia, but difficulty falling asleep mostly. But now it's pretty much, I'm sleeping like 8 to 9 hours a day, which is great. But yeah, so there was struggles, for sure. But things, like reminding myself that it's part, like it's this, there are going to be uncomfortable things that happen along the way. And then as far as tremors go, so I had a tremor prior to starting medication, that sort of increased while taking medication and moved to other parts of my body. So that's improved. As far as it's not so much in my face anymore. I still have a bit of a tremor in my hands, especially if like I'm stressed out or something like that. Memory is a lot better. But that's also a struggle as well. Dealing with sort of like memories of past trauma. But the nice thing is I feel, like better equipped to like handle things that are coming back. So yeah, I mean, mood swings, not so much anymore. I'm not really experiencing a lot of the symptoms that I had when I was on, I'm still on medication, but I'm close to being off.
So cool.
But yeah, most things that I believe are related to the medication have decreased significantly, if not have resolved. And as far as, like the physical symptoms that I was dealing with, that's still something that, like I'm still searching for information on stuff like that. But as far as what I believe was truly related to the medication that I was using, those have cleared up a lot. I feel in control,
Mm.
proud,
Heck yeah.
powerful,
Mm.
that, these are things that I felt or I was told that could not be handled
Mm.
by myself,
Mm.
like, so I believed that. I needed support, to be able to sort of like tackle what I was struggling with, when really, like I'm capable. Like I did need support, but not support from a pill.
Right.
So yeah, it's a feeling of just like great control. Um, so a lot of the things that I was sort of concerned that I would lose, by sort of coming off my medication, or things that I was sort of just afraid of in general. One being control again, because I'm a bit of a control freak. Uh, those are things that I've gained from this process for sure. I've gained so much more, from this than I thought I'd be able to. So like things that I didn't even really consider, like trusting myself, trusting my instincts, trusting other people to help me. So there's a lot that I've gained from this process for sure. One would be, you're not going to be stuck forever.
Mm.
Change is inevitable. Like it's impossible to be in the same place forever.
Yes.
Trusting yourself, but also, trusting other people to help you. But yeah, not settling for one person's opinion about what's going on, in your mind or your body. And then being brave enough to seek help and to be honest about what's going on with yourself, because sometimes it's embarrassing and scary, but it is really important to share everything, when you're ready. But yeah, but yeah, definitely things are not going to be the same forever. You're not going to feel stuck forever. You're not going to feel like you're drowning forever. Um, it'll change, and there's options, even though it might take you, like a while. There's options for you, for sure. Every person that I've experienced in free range has been, one, knowledgeable, two, interested and concerned with what I'm going through, and sort of like excited about sort of learning about me, and three, just very like kind and understanding and like warm. It's, like again I said, it was a refreshing change to just, sort of be in an environment that felt just so welcoming. So yeah, everyone's super nice.